This is the office. I've been here at this location 24 years now.
24 years.
I've been taking care of mamas for the last during that time. Mostly I do prenatal care, delivery babies at the hospital, and also gynecologic surgery. So we can start over here. This is our office, and I've been here 24 years, so these are the
different awards.
the things that people
Kind of
have been
awards.
recognized for. So,
Dr.
yeah.
Pat, could you introduce this to
Okay. So these are the ones that over the years patients will vote for their doctor, it's a group. It's from a group of large amount of patients that will vote for that. And also, when I first started, our community have a high rate for cervical cancer. So the local newspaper, Los Angeles Times, came and interviewed because I was doing a lot of pre-cancer screening for GYN pre-cancer and so forth. And during that time, when I was working at Fountain Valley Hospital, there was many issues with, the big concern about obstetrics, having deliver a baby is what happens to them. Most deliveries do okay, but once in a while, there is the issue of postpartum hemorrhage, the bleeding after having a delivery. And so we have strategies. That was 20 years ago. We still continue to have those strategies to reduce the death and the problems with too much bleeding after delivery. And so that's what they had recognized me for, is being able to act quickly and to stop the bleeding. Nowadays, with a higher amount of patients that come through the hospital, the technology has improved, and then we have better medicine to help in the situations where the patient, after having the baby, then there's problems with the placenta and with bleeding. And so they recognize me for that. Mm-hmm.
Thank you.
So, of course, these are the moms that after the delivery, they come back, they give me lots of photos.
Yeah.
I cherish those is because now the babies that I've delivered 23, 24 years ago, now they're big kids now.
Oh, yeah.
And sometimes I would see them. But this is a small portion. I have an album this big. But nowadays, everyone has internet, so no more
email.
no more albums. And so now I get to see them on social media, the kids growing up. And so recently I went on a mission trip to Vietnam to do medical care. And then some of the students from the colleges, the UC schools, they come up to me, they said, "Oh, my mom said I delivered them." So they are now 23, 24 years old. So it's actually working in a community like this. We get to see a lot of the patients that come back. So, but this is where I take care of patients. So in the office, one of the things that for obstetrics during delivery is the use of ultrasound. So, ultrasound is a tool to help us look at the baby's, the water around the baby toward the last few months of delivery. The water around the baby is very important. The size of the baby is important. Also looking at where the position of the baby. Yeah. And of course, during the early portion of the pregnancy, we check to make sure that the pregnancy is not outside the uterus, and we can monitor the growth that way. Mm-hmm. So we try to have each of the rooms, they have an ultrasound machine also. So these ultrasounds have the capability to do, the 4-dimensional, 3-dimensional ultrasound. And of course, 3 to 4-dimensional ultrasound, the patient really like it because it gets to see the baby's
face.
Yeah.
Oh, so all the ultrasound machine is
are 3D, 4D capable.
Oh, okay.
Yes. Mm-hmm. So, usually when we visit, when the patients come, then that's the seat that we reserve for the fathers. The fathers can come in the room for this to be with part of the.